listening to Honestly Aging by VigRHealth, a podcast where we explore what it's like getting older, the peaks, the valleys, and everything in between. In this season of Honestly Aging by VigRHealth, we're covering topics related to solo aging. I'm your host, Cheryl Proska. Let's grow old together. On today's episode, I am joined by my colleague, Katie Starrantino, Friends Life Care Director of Wellness Initiatives. Katie is a licensed clinical social worker, certified dementia practitioner, has a master's degree in education, and is a licensed counselor in the state of Pennsylvania. Katie, welcome. Thank you for being here. How are you?
Hi, I'm good. Thank you so much for having me. I'm really excited to talk about this topic today.
Absolutely. So, speaking of the topic, you are joining me today to discuss how solo agers can benefit from having a therapist in their life and to understand finding a therapist that is right for you. First, let's debunk any stigma out there about shrinks. Then onto the top 5 considerations when selecting a therapist.
So I am a therapist and I have a therapist as well. And the concept of talk therapy goes back centuries. So this is nothing new. Many of us have heard of Sigmund Freud. He started his work back in the late 1800s. Feeling better by voicing your concerns and embracing change is something that's been around for hundreds of years. And we've been able to gather some pretty reliable research about its effectiveness. I understand that it's difficult to make the choice to speak with a therapist. There have been many people in my life who were hesitant to start working with a therapist, but then took the leap after the pandemic. And when I talk to those people now, I hear this new sense of calm. They feel that their therapist listens to them on a deeper level than a friend or a family member would be able to. And they appreciate the guidance and connection that's come from forging a relationship with a therapist.
I agree. The pandemic's effect on mental health has been extraordinary and helped ignite more conversation and openness around the subject. After a brief ad, we will move into your top 5 considerations when picking a therapist. Would you prefer to age independently in your own home or live in a nursing facility? I know what I'd rather do. Friends Life Care membership offers just that. Plan today for a future lived at home with vitality, independence, growth, and resilience while protecting your savings. Learn about your options at a free seminar or webinar. Register at friendslifecare.org/register or call 215-628-8964. Welcome back to Honestly Aging by VigRHealth, where today I am joined by my colleague, Katie Starrantino, to discuss the topic of aging solo. Are you taking time for your self-care? Katie, let's hear your top 5 considerations when picking a therapist.
All right. So the first one I want to talk about is insurance versus private pay. So that's really the first decision you're going to want to make because that's going to help you choose the right therapist for you. If you decide that you want to use your insurance, there's a few ways to locate therapists who accept your plan. The first is you can just flip to the back of your insurance card and call that number and ask for a list of therapy providers that work with your insurance company. You can get that mailed to you, emailed to you. For those of us that are a little tech savvy, most of these insurance companies have a portal where you can find this information. Another option is to utilize a Find a Therapist tool. And there's many of these, but 2 that I like the best are Psychology Today's Find a Therapist or Grow Therapy. And we'll link those in the show notes if you'd like to give them a try. So the Find a Therapist tool, like the two I just mentioned, can be utilized if you're interested in pursuing a private pay option as well. I have had people ask me if it's, quote, better to see a therapist who takes insurance or one who accepts only private pay. And I will say that in my experience, the truth is that the majority of therapists are accepting a mix of both private pay and insurance. It would be really challenging for a therapist to have a full-time practice strictly with clients who are paying privately. So you'll see most therapists accepting a mix.
I find what you just said extraordinarily reassuring. It sounds like there are a plethora of resources available to help people find and connect with a mental health professional.
Yes, and before I jump into my next tip for you all, I do want to mention that if insurance or private pay are challenging for you, there are resources for people to have a very low cost option. One that I like a lot is Open Path Collective, and we can link that in the show notes for you as well. So my next tip is to talk about credentials. And those are all the letters that you see after your therapist's last name. And you kind of wonder, what does that mean? And what educational background would be the best fit for me? So I'm a therapist in Pennsylvania, and I'm speaking about Pennsylvania, but there's a lot of commonalities within the state. So you might hear the letters be a little different where you're looking, but they will mostly be pretty similar. And some of the common credentials you'll see are LCSW, that's a licensed clinical social worker, LPC, which is a licensed professional counselor, LMFT is a licensed marriage and family therapist. Then you'll see PsyD and PhD. So any of the ones I mentioned that start with the L, the licensures, those are master's levels clinicians. And these clinicians can diagnose, treat, and assess just like a clinician with a doctorate. The difference between these professionals is their coursework. So they obtained a master's degree, and they're all going to look kind of different in what they studied. And I would encourage you to ask them about that. What did your education look like? What was your passion when you were studying? Where do you feel you excel? That's a great question to ask. And then the PsyD and the PhD, these are doctorate level clinicians. The PhD has more of a focus on research, where the PsyD has more of a focus on directly applying psychology to a client.
So, what credentials might you recommend for someone who is dealing with loneliness and isolation?
That is a great question, and one that I get a lot in terms of what credentials should I look for when I find my therapist. And we're going to jump into that a little more later, but to answer the question a bit now, it really comes down to two things. The therapist that you have the connection with is the best therapist. It does not matter what letters come after their name, and the research bears that out. And also, if there's a specific problem you're looking for, you want to make sure that your therapist has the experience in the theory that has the best research for that. So loneliness and isolation, you might look for what's called narrative therapy, some cognitive behavioral therapy. It'll really depend on your goals. So I'd like to kind of move on to number 3, which is online or in person. And this was something we didn't talk about all that much before COVID-19. Even though online therapy did exist then, but it has really exploded since that time. And there's research showing that online counseling is effective in reducing psychological distress. So there's no reason that you have to go in person if it feels more comfortable for you to see your therapist online. However, I certainly understand there's many clients who feel more comfortable attending in-person sessions. That is a personal decision. It won't impact the efficacy of the work you're doing. And there's no wrong answer for it. So if you do decide you want to go ahead with some online counseling, ensure that your therapist explains what platform the counseling is going to be over and what the confidentiality limitations are of that platform, because you are talking about some really sensitive topics. And we're also going to put in the show notes here some research that show the efficacy of online counseling versus in-person counseling.
So, what are your thoughts on text therapy?
Text therapy does not have as much research behind it at this time. And I actually have done text therapy with some clients for a platform I used to work for. My thought is it's better than nothing. But if you're really dedicated to reaching the goals, I would encourage that face-to-face over video or even phone. But there are some people, for example, who have extreme social anxiety. And if that's where you are right now, that is absolutely better than nothing. It's just getting started. It's great.
And how about your thoughts on celebrities partnering with and promoting mental health apps?
That's an interesting one. I am excited to see celebrities talking about mental health. And I think that part of it is wonderful. Now, promoting the mental health apps, I do disagree with. I think it's not that celebrities necessarily have a sense of ethics, but I think if they did, it would go against that. And I would encourage you to do your own research and not just go with the app that your favorite celebrity is promoting. So I want to move on now to what the research says about a successful client-therapist relationship, which goes back, Cheryl, to your question, what credentials should I seek out? The studies show that one of the most important things you can do in order to be successful is find a therapist that you click with. This is what we call a therapeutic alliance. And finding a counselor you feel comfortable talking to can be more important than the school they studied at, or if you're seeing them for virtual or in person, or if they have a master's or a doctorate. And I know that goes against what many of us think, but the research bears it out time and time again, because if you make that alliance with someone, you are going to be able to get into such deeper work than somebody that maybe does have a PhD, but is really challenging to talk to. One of my favorite podcasts, aside from this podcast, is called Science Versus, and they have an episode called Therapy, Does It Work? And they get into this topic of getting along and having that therapeutic alliance. So we'll link that for those that might want to listen to that.
Katie, what advice can you give for handling a situation where there's not a match between the client and the therapist?
I love this question. And what I tell people is if you went to a restaurant and you had a meal you didn't like, you wouldn't say, I'm never going out to eat again. I mean, that would be crazy. But people have experience with one therapist and they throw their hands up and they say, I'm done. Therapy is not for me. It is really hard to go in and bare your soul to somebody and not have that connection. And it's extremely vulnerable. And I understand that. But please, please, please don't give up. If you go and it's not a match, first and foremost, the majority of good therapists are open to you sharing that and saying, I don't feel a connection. I do want to continue this. Can you help me? Can we talk about who you think would be a good match for me? Do you have some ideas for a referral? Or you leave that session, you don't have to go back. You use some of the tips we talked about earlier, the Find a Therapist tool, and you try again, but please, please don't give up. And the final thing that I want to mention today is a question I get pretty frequently, which is what modalities should I choose to best address my issue? This is a really complicated question because there's so many different issues that we're seeking therapy for. So I'm just going to kind of talk about 3 that are more common right now and briefly review what the research says would be the most effective modalities to treat these. So anxiety disorders, many of us are familiar with those, especially during and after the pandemic. You will find a lot of research on cognitive behavioral therapy, or CBT, as a preferred therapeutic treatment for anxiety disorders. I do have some research for that. I'll put in the show notes for you. Depressive disorders, so depression, you'll also see cognitive behavioral therapy used there. Cognitive behavioral therapy has a great deal of research behind it. And then post-traumatic stress disorder, or PTSD, you may have heard it called. That favors cognitive processing therapy, CPT, and something called prolonged exposure therapy. And these are just another tool you can add to your toolbox as you're searching for a therapist.
For those of us unfamiliar with these types of therapies, me included, can you provide a little more context so that we can familiarize ourselves?
Yes, I certainly can. I'm not going to speak to cognitive processing therapy because it's not one that I specialize or am familiar with, but you can do your own research there. And I will talk about cognitive behavioral therapy, which is CBT, or prolonged exposure therapy. So CBT, like we said, great body of research behind it. It's exactly what it sounds like. So cognitive, we're looking at the brain. Behavior, we're looking at your behavior. How is what you're thinking in your mind affecting your behavior? how is what you're telling yourself influencing what your day-to-day looks like? So if you wake up every morning and say, it's not even worth it, why do I try? Maybe you're a little more reserved. Maybe you don't put yourself out there. Maybe you're sluggish. It's affecting your behavior. So that's cognitive behavioral therapy. Prolonged exposure therapy is putting you in situations that feel really uncomfortable and doing those for longer and longer periods of time. So for example, let's say, heaven forbid, somebody had a really horrible car accident. We might start with sitting with them in the therapy office and playing the song that was on the radio during that accident for just 20 seconds. And we're going to work our way up gradually, and again with a professional who is holding your hand and supporting you, and never without your consent, but work our way up to maybe visiting the scene of the crash. And all the while teaching you skills to monitor your anxiety. And it's a tough one, prolonged exposure, but it does have a good body of research behind it.
Thank you. So we've debunked the stigma around therapy, covered your top 5 considerations when selecting a therapist, and now I believe you have some therapy successes to share.
Sure. Yeah. So I'm just going to do a quick case study of somebody who was reticent to see a therapist, and then they found a great therapist, and we're living happily ever after, I guess, is the story when we match with our great therapist. It's not uncommon that I'll see a client who tells me they were holding off on starting therapy. Many times they've seen a therapist in the past and didn't have a good experience. Like we mentioned earlier, maybe they said, that's done for me, I'm not doing this again. And it took them years to come back around again. Because they didn't have a good experience, so they just wrote off the idea in general. I completely understand this because of the vulnerability it takes, but it does sadden me because you're missing out. And again, I'm going to reference that comment I made about the restaurants. You know, you would go out, you would never stop going and getting fabulous Italian food because one time your pasta was bad. And I understand that's different, of course, than the vulnerability that comes along with therapy. So I get that it's scary and starting the counseling process is a challenge, but I really would encourage you not to give up. I have seen amazing change from people that dedicated themselves to the process and didn't give up. I mean, I'm talking sometimes life-changing stuff, and I don't want to oversell it, but I think that after listening to this podcast, you probably have gotten the understanding that therapy works and therapy is helpful and it can change your life. So I would encourage you to do that and just not give up.
Katie, you are a wealth of knowledge. I appreciate your generosity in helping us destigmatize therapy, explore ways to select a therapist, and sharing therapy successes. I'd love to have you back on the podcast, and we'll be in touch. Thank you for listening to Honestly Aging by VigRHealth. You can find links and show notes from this episode on our website at friendslifecare.org/podcast. Thank you to Katie Starrantino for joining us today. You can learn more about Katie by visiting our website, friendslifecare.org. If you like our show, please rate, review, subscribe, and join us next time. To learn more about aging with vitality, independence, growth, and resilience, subscribe to our blog at friendslifecare.org/blog.